Welcome everyone to ISOHA's 2020 inaugural North American Who's Who in Student One Health webinar, and we are so happy to have you here. Just to give you a brief introduction of the planners and hosts for this webinar, my name is Evan Griffith, and I'm one of your ISOHA North American continent representatives, along with Jessica Garcia. I received my master's in conservation medicine in 2017, and I'm currently a DVM MPH dual degree student at the Cummins School of Veterinary Medicine at Tufts University. Unfortunately, Jessica can't join us today, but I wanted to give you a brief introduction for her as well. She received her MPH in epidemiology and global health at the University of Southern Florida, and she's currently a research and data analyst.
Hey guys, I'm Bailey Archie and I'm the Educational Committee Event Manager for ISOHA. I help with the webinars, so I'm here unmuting mics and that sort of thing today. And I'm a second-year veterinary student at Mississippi State.
Hey guys, I'm Neil Vizzo. I'm a trustee with ISOHA and I'm a veterinary student at Iowa State University. I'll be handling questions kind of behind the scenes, so if anyone has a question, they can type it into the question box that they'll see in the little console, and I'll do the best I can to respond to it.
All right, great. So I just want to give you a brief outline of our webinar today. So first, I'm going to tell you a little bit about ISOHA as an organization. Then we're going to hear from Dr. Cheryl Stroud of the One Health Commission with an update. Then we'll get to the One Health student group presentations. We'll have a question and answer session, and then we'll have a brief closing statement. So to give you a little bit of background of ISOHA, if you're not familiar, the International Student One Health Alliance is a student-run organization that aims to connect students across the world who are interested in addressing issues at the interface of human, animal, and environmental health. We aim to provide a platform for students to collaborate and share One Health educational and professional development opportunities. This is our current ExCo for ISOHA. And you can reach them at any time with questions at isohaexco@gmail.com. So you've seen their pictures, and of course you can go back to this at a later date as this webinar will be recorded. And here we have our ISOHA continent representatives, of course for North America, myself and Jessica, but also we have continent representatives represented across the world for ISOHA. Okay, so this is a really neat map. This is actually a representation of all the groups that make up ISOHA, so you can see they're spread out all across the world, and you can actually access this map at that URL that's at the bottom of your screens. This is just what we have for North America. So as you can see, we have a really large number of groups that are represented. And this is another resource that ISOHA has. So this is actually a map, again, that you can access at the URL on your screen. And these are educational opportunities around the world. So if you're interested in furthering your One Health education, you can click on these on the map. It's interactive and you can learn about those opportunities. And we just want to put a plug in here. If you know of any opportunities that aren't on the map, please contact us and we will love to add them. So I'm pleased to next introduce Dr. Cheryl Stroud, who is the Executive Director of the One Health Commission and an expert in bringing people together across disciplines. She helped to create the North Carolina One Health Collaborative in 2010 and was selected as the AVMA representative to the One Health Commission in spring 2011 and was appointed Vice Chair of the One Health Commission Board in 2012 to become Executive Director of the Commission in September 2013. Dr. Stroud believes strongly in interdisciplinary collaborations and seeks, via the Commission, to connect One Health stakeholders into active teams, creating strategic networks and partnerships that will educate about all One Health issues. So without further ado, I am happy to pass the mic over to Dr. Stroud.
Hi, thank you, Griffin. This is a real pleasure to get to have all groups, the student groups around the whole entire North American continent come together and get to know each other and find out what each other are doing and find ways to connect. So I just want to applaud the work of the ISOHA. It's been so much fun to kind of work with it as it grew and evolved. So thank you very much for allowing me to join you guys today. Next slide, please. So we all know what's going on right now around the world, and it's a very teachable moment for those of us working in the One Health space. I hope that you'll help people understand that that One Health is more than zoonotic diseases, and part of it is kind of an underlying attitude of how we need to really change our attitudes as humans toward our place on planet Earth and to preserve the Earth, because it's not, nature is not the enemy here. The wildlife is not the enemy. It's what we humans are doing. So it's a very teachable moment to share with colleagues who are curious about what all the One Health talk is. Next slide, please. There have been warnings for years from some pretty prominent people that we were not ready, and we're seeing that in the extreme right now. Next slide, please. And many of you may have been following this map for Johns Hopkins, and they're doing a fabulous job of plotting the progression of this pandemic. I just wanted to make sure you're all aware in case you want to tune in and use it as a resource. Next slide. So in addition to the opportunities that the students have been putting together for you guys to have ready access to, there's also an online opportunities bulletin board that the commission has been doing now for a couple of years. And the cool thing is you can actually submit any opportunities that you're aware of directly there. And we've been trying to kind of integrate and correlate across what ISOHA is finding and what the commission's finding, and it's always a work in progress. So please help us, both ISOHA and the commission, make sure that opportunities that are out there are posted for students to find access to. And you can see from our opportunities page, we actually link to the ISOHA page. That map on the bottom right is the ISOHA map. Probably not up to date. I probably did a screen capture some time back. And so I hope all of you are aware of the One Health Happenings newsletter that we try to do once a month. It really brings news about One Health things that are going on from all around the world. Next slide, please. If you're not already getting those, please go on the Commission's website. You can sign up for the student listserv. The URL's at the bottom of the screen there, but you'll notice at the top on the green buttons, it's under Leadership and under Students for One Health, and then there's the student listserv there. For faculty and colleagues who are not students, they can submit themselves and add themselves to the listserv at a different page, the One Health Commission Global One Health Community listserv. So for that one, you go over to the green button that says Resources and Services, and you would drop down to join the Global One Health Community listserv. The listserv is over 10,000 people around it goes to people around the world, and many of those people actually forward it into their own networks. So it's a very powerful way to get news out about events that you're having. Next slide, please. I just want everyone to be aware also of an initiative that's been forming up now for about a year. The working groups are just starting to get going. And I love the acronym for this. We started this, it grew out of a One Health Education Task Force that's really been, started out thinking we need to start finding ways to teach younger and younger people about One Health and One Health issues. But it has grown into an international One Health for One Planet education initiative. And if you look at One Health for One Planet education, the acronym for that is One Hope. So this is really starting to be picked up, and these working groups across the bottom are forming. So any students that would like to be involved are welcome to join in and get involved. Next slide, please. And hopefully all of you are very aware of One Health Day, which has been going now since 2016. Next slide, please. I just want to be sure that all of you are aware of the student competition. There's great guidance on the student competition page now that it has evolved over the past year and a half to really make it easier for students and judges to assess exactly whether the criteria have been met, and be aware that there are $2,000 cash prizes for groups. Up to 4 regions of the world could each win a $2,000 prize. So we'll be announcing soon the winners of the 2019 competition. So keep your eyes out for that. Next slide. What I really wanted to make sure to have a couple of minutes to share with you guys today was about the One Health bills that are actually have been introduced into our U.S. Congress. So this is specific to the United States. In June and July, a One Health bill was introduced to establish a One Health program. It was for emergency preparedness. It's the One Health Emergency Preparedness Program. Next slide, please. There's actually a website that you'll find on the Commission, a web page on the Commission's website that you can find more information and lead you to actually go and look at those, or you can just search S1903 or HR 3771. This is the third time we've had One Health bills introduced into the Senate, but it's the first time that it's come forward in a bipartisan way from both parties, and it's the first time that a bill such as this has been introduced into the House of Representatives also in a bipartisan way. So right now those bills are sitting in committees, and apologize, I just can't help but mention it kind of feels like Nero fiddling while Rome's burning, because we've got these bills sitting in committee that could really be helping us manage this, and we all know that what we're experiencing now with COVID-19, it's what the One Health community has been warning and teaching about for over 15 years. So it's pretty terrifying to see it playing out. Next slide, please. And on that page, you can find linked to this issue brief that has been shared to lawmakers in the U.S. Congress, and you're welcome to download it and use it. There is a coalition, an informal coalition of One Health partners. It's over 70 organizations so far have signed on in support of these bills and in support of One Health. So the packet that's posted on the web pages actually has, in addition to these 2 pages you're seeing now, actually has some additional information that can really help people who are not familiar with One Health understand the importance of it as we're trying to bring these bills out of committee and get them to the floor of Congress to be voted on. Next slide. One of the things, there is an ad hoc group that's kind of been working in the background, and Neil Vizot, that you met just a moment ago, has been involved kind of representing students to help us raise this awareness and educate lawmakers and policymakers about this incredible urgency of getting these bills passed. One of the things that ad hoc group has done is to set up and organize tours for lawmakers of the Outbreak exhibit in Washington, D.C. So we did this on October 30th, and we did it again on February 20th, and who knows, we might try to do it again. As I understand, we had about 15 people, probably mostly staffers for lawmakers' offices, who participated on February 20th. That was during a congressional break, so most of the lawmakers themselves were probably away, and we kind of did that on purpose so the staffers could get there. The other thing I really want to be sure that everybody listening here is aware of is that this exhibit can travel. They've prepared versions of it that can be printed either on fiberboard or as pop-ups, and it's literally traveling all over the world, but it's an incredibly powerful opportunity, especially in this moment, to bring this exhibit to your area, bring it to your university, bring it to a mall or a library, or anywhere where the public can see and understand the relevance and importance of One Health for what's going on right now. So if you wanted to bring it, you would just go to the Smithsonian and explore, or I can, please feel free to reach out to me, cstroud@onehealthcommission.org, or any of the ISOHA group, to get more information and get you connected to the people at the Smithsonian who could help you bring this to your university or to some local public area, so that we could use this as a teachable moment for One Health. What you would need is just a small budget to be able to print the panels and some standing design. There's several ways you can do it with easels, or they do some that actually, the poster collapses down in itself in a little metal carrier, and then you can just pop it right up. So I urge you to consider that. Next slide, please. And a lot of you, I hope, are aware that before the Corona madness hit, that both the Senate and the Congress, because of some of the leadership of Senator Feinstein's office, and of course, Senators Tina Smith and Todd Young, and Representatives Kurt Schrader and Ted Yoho, they declared, this happened before the end of the year last year, declared January 2020 to be One Health Awareness Month. And the idea was to start the new decade off on the right foot with raising awareness about One Health. And the reason I'm mentioning that to you now is that all those resources that we put together for a One Health Awareness Month campaign are still on the website and still extremely useful for posting on Facebook and just helping people understand the many faces of One Health. Of course, zoonotic diseases kind of started the One Health conversation, and right now is a major thrust for this One Health teaching moment, but there are many other faces of One Health that we need to help people understand about. Next slide, please. On January 30th, a group of us also were able to hold a briefing on the Hill for the Senate and the House. Basically an educational opportunity for Senate and House staffers of the lawmakers' offices to come and learn about One Health, and then to also learn about coronavirus. So we had veterinarian Bernadette Dunham speaking, and MD Dan Lucy, who, by the way, is over in Korea right now. I would love to hear how he's doing. Go and check out, of course, there you can also see there's a place to click on and click on and download the handout that I showed you a minute ago. So feel free to use those resources if you want to go and talk to your lawmakers, whether at the local or state or international or national or even international level. Next slide. So I really appreciate the opportunity to speak to you guys today. I want to thank each and every one of you for your leadership for One Health and for moving your One Health student groups forward, and for coming together and joining hands so we can literally synergize our efforts in this. So thank you so much, and I'm looking forward to hearing from each and every one of you.
Great, thank you so much for that fantastic presentation. Now we're going to transition into club presentations. So presenters, please raise your hand when it's your turn to speak, and Bailey will unmute your mic. Also, some of our groups couldn't have a representative here today, and they've sent a script that I'll be reading or audio that we can all listen to. If anyone has a specific question for a club, please enter them in the chat box, and Neil will compile those and we can get to them in the question and answer session. And now I am happy to get started with the Western One Health Club.
Okay, Danny, you're on.
Hi, everyone. Thanks for having me here. I'm Danny Kalani. I'm coming here from the Western One Health Club. I'm the co-president for this year, and we're primarily an undergraduate student group, and we're run at the University of Western Ontario in London, Canada. We have a few different resources that we use to connect with our members, including a Facebook group. We have a Gmail. We also have a website with some resources on it. It's not the most updated, but does have some interesting resources, like a list of some opportunities that students could apply to for the summer, and kind of a tutorial on how students can go about getting research positions for the summer, which a lot of those positions are kind of debunked now with COVID-19, but regardless, they're there. We also have an Instagram page that we share a lot of our events and promotional material, and also just some material that tries to make some awareness around the One Health initiative. Next slide, please. And here's just a few pictures from various events that we've put on. We've had a trivia night, which was highly successful, which was like a mix between some general trivia as well as some One Health trivia, so that we could get some awareness out there while also attracting some people from different kind of areas that maybe hadn't heard of One Health before. We've also sent students off to a business case competition at the business school here at Western. And our students ended up coming in second place there, using a lot of the skills that they've acquired. So considering many different perspectives through kind of like a stakeholder analysis, which is a very big part of One Health. And then also that gave them a good opportunity to use some diverse perspectives in coming up with solutions as well. We also had an event that we called Walk Hired, which was an internship and research panel. So we gave students an opportunity to hear about what kind of opportunities exist for students who are graduating and going off and looking for somewhere where they can make a difference using the One Health framework. And then we've also sent students off to an event. It was a poster day that was held at the University of Guelph, and we gave a presentation about our club and the development of it over the past 2 years. And we're hoping that that can inspire students from other universities who came to that conference to start their own One Health clubs in Ontario. All right, I'll leave it at that. Thank you so much for having me.
Okay, Emma Zhang, you're on now.
Can you also unmute Julia? We're actually splitting this talk.
Yes, 1 second. Okay, it says Julia is self-muted. There we go. You should be good now, Julia.
Thank you. So Emma and I are both the co-presidents of the School of Veterinary Medicine, UC Davis's School of Veterinary Medicine Students for One Health group. And thank you everyone for organizing the webinar and Dr. Stratford, the great presentation. We wanted to introduce a few of the initiatives that we have been placing or putting on for our club over the years. Two of the main ones are the Knights Landing One Health Center, which is a free monthly veterinary clinic for pets of the community of Knights Landing, and Robbins, which are both rural, primarily Spanish-speaking communities located north of Davis. And they're actually held jointly, the clinic is held jointly with a One Health clinic run by the UC Davis School of Medicine. So the human patients can get their health checkups, and then later on they can go and get their pets also looked at by veterinary students and vets as well. Our other large event that we have is the annual One Health Symposium, and that brings together a multidisciplinary group of professionals ranging in human medicine, veterinary medicine, engineering, agriculture, social economics professionals as well. And we have a day of discussions on current One Health issues on One Health Day. So our most recent symposium was called Interfaces, looking at One Health at Borders and Margins. So looking at political interfaces, environmental interfaces, urban and rural areas as well. And Emma's going to take it over and talk about our other initiatives as well. Oh, and here's a few pictures as well from the symposium. It really brings together a large panel of different professionals to give their perspectives on One Health issues.
So two of the other kind of pretty big events we put on are more public health focused. So we have Pandemic Night and the Outbreak Scenario. So what Pandemic Night is it's kind of like a really low-key kind of networking event meant for students to be able to talk to professionals currently working in public health. So Pandemic is a board game, and what we do is we start off with 3 kind of really short TED-style talks from public health professionals talking about current One Health issues. And then we finish off the rest of the night with some food and beer and play the board game Pandemic at tables where we have a mixture of students as well as professionals. So it's just a fun way for students to get to know public health professionals. The other event we have is the Outbreak Scenario, which we do every year. So the Outbreak Scenario, we work really closely with our local USDA office in Sacramento. So we work with the veterinarians there to come up with an outbreak that's relevant to what's currently happening, to get students some kind of hands-on experience with outbreak, like with addressing outbreaks. So last year our scenario was on the virulent Newcastle's disease outbreak in poultry. So basically, students went to kind of a simulated house to do a check on backyard poultry, and they got led through physical exams, blood draws, and kind of how to interview the owner of the backyard flock and things like that, just to kind of learn how outbreaks are addressed at the backyard poultry level. And some of the other kind of smaller events we have throughout the year, we have the seminar series. So it's basically a series of lunch talks. So we've had different professionals come to give us lunch talks, either faculty or some graduate students, just to cover some One Health issues. Mosaic is currently basically a smaller subset that's currently working on doing backyard poultry education in Southern California, also focused on the virulent Newcastle's disease outbreak. And the One Health podcast is also another kind of subgroup that we have that's working on interviewing different professionals within One Health and then trying to get those episodes recorded and then sent out. And they're currently still interviewing some professionals. And that is pretty much all we have for what UC Davis does. Thanks for your time.
Hey guys, I'm Neil Vizzo again with Iowa One Health. We're based primarily out of Iowa State University, but we also include activities and membership from other places all around the state. We're primarily a vehicle, or we have historically primarily served as a vehicle to put on the Iowa One Health Conference. And that was first done in 2016, then we had a 2017 iteration, 2018. We have not done one since, but there's current conversations on sort of what directions to take with the club and what to do with it, including collaborating more with other nearby medical schools, other pharmacy schools perhaps, but you know, we'll see what happens. Next slide, please. So one of the interesting things about the 2017 Iowa One Health Conference, that was a big success actually. We were able to engage basically every major college / university in the state, and as kind of an add-on to that, we also some of you may have heard of this already. We were actually able to get a Iowa One Health Month proclamation going, and there's something that I want you all to do right now. Actually, I'm going to copy paste this into the, where is the chat box? Is that below the questions? Well, regardless, I want you all to open Google, type in the name of your state. After that, type gubernatorial One Health, or type in gubernatorial proclamation. For 9 out of 10 of you, there will be a link. It's going to be the first or second one that will take you directly to a link where you can actually upload language for something like a proclamation, which I'm going to link when I can actually find the chat box, that we had for ours, that you can basically directly replicate in your state. And that's a great way for everybody to actually get prominence for the One Health methodology, for the One Health approach. And it works for us. We've actually done it again just this past year. And actually it was done on the federal level by Deb Thompson in that was Feinstein's office, I believe. So if every state could do that, I'll be incredibly happy with it. And we can definitely send out more information about this after the webinar as well. But I would love to see everybody who can do this do it, because it's actually not hard at all. That's really all I had to say about this. A lot of the rest of this is kind of old news. And if you're interested, you can just read the rest of it when we send out the PowerPoint. But thanks for having me. I appreciate it.
Okay, Erin Vermaga, you're on now.
Okay. Hi, I'm Erin. I am the current vice president of UW-Madison's One Health Club. We're mostly based at the veterinary school, and basically we serve as a resource for externships and careers for our veterinary students. We do a lot of collaboration with other clubs in the vet school. So we have a disaster relief club that we've done events with in our WESAM club, or our wildlife and zoological medicine club, and our bovine club. We also collaborate with our School of Medicine and Public Health. We're looking to strengthen our relationship with them. And then we also have put on events with UW-Madison's Global Health Institute. Next slide, please. So some examples of club events and activities. In November, we had a One Health career panel where we brought in public health professionals from our Wisconsin Veterinary Diagnostic Lab, our state public health lab, I think a couple USDA vets, and then some doctors from our School of Medicine, just to talk to vet students about different careers in public health. We plan to have an interdisciplinary panel on COVID-19, but it was canceled because of COVID-19, so maybe we'll have it in the fall. So we were going to put that on with our school's School of Medicine and Public Health. In the future, we're looking to meet with the USDA PHS to get some more ideas about some career opportunities or externships for our vet students. And then as a fundraising opportunity, we're looking at doing a drug take back program so people can bring in their unused medications from themselves or from their pets. And we're also having an ongoing composting activity where people can compost at the school. So if you have any questions, there's my contact information, and thanks so much for having me.
Perfect, thank you. Okay, Michael Zeiner, you're on now.
Hi, everyone. So my name is Mike Zeiner. I am the president of GW, or George Washington University Student One Health Group. I'm a second-year master's student in epidemiology, and I'm graduating very soon. So our president-elect is Abby Hedgelin. She is unable to make it today, but I wanted to put her name and her contact information there for you guys all to see. And our faculty advisor is Dr. Bernadette Dunham, who was mentioned briefly before, but just to give you an overview, she's the former director of the Center for Veterinary Medicine at the FDA, and she is currently an advisor for the new FDA One Health initiative. And we're very lucky to have her helping us out with our many events. Next slide, please. So I just wanted to give you one example of our events that we host. So this is our One Health Day event from 2019, and we focused on a theme called Educating the Public on One Health. So we had three great speakers. The first was Blair Budd, who is the director of the One Health Academy. If you guys haven't heard of the One Health Academy, they're a great resource in Washington, D.C., but I believe all of their presentations are online. They basically host One Health talk every month of various topics. Then we had Dr. Deb Thompson, who I believe Neil mentioned earlier. She has done a lot in the field of One Health, and specifically she's created One Health curriculums for elementary school students, which is a very important thing at this time. And then we also have had Dr. Dan Lucy, who was also mentioned earlier in one of the presentations. He was one of the originators of the Outbreak exhibit, and since we have the Outbreak exhibit based in Washington, D.C., we thought it would be a great idea for him to come and speak about it. I know recently Dr. Lucy said he came back from China back when COVID-19 was really ramping up here, and he said that he was barely screened at the airport, and he was just distraught with the response that we're having right now. So I'm hoping he's doing well in Korea, doing great things. I think that's it for me. Please feel free to email me or ask me any questions. My email is on the presentation. All right, thank you.
Perfect, thank you. Next up, we have Texas A&M. So I am unmuting Amanda now, and then Danielle. Danielle, you're unmuted as well.
Hi. Can everyone hear me?
Yeah, we can hear you.
Great. So we are the Texas A&M University Student Health One Health Association. Amanda and I will be co-presidents next year of our club. So a little bit about what we do is we are involved with professional students. So particularly at A&M, we have the vet school, medicine, nursing, pharmacy, and public health. We also include graduate students, especially those that have more of a policy side and like wildlife biology. Those are really big. And then we're trying to get more undergrad students to be involved as well. And then we have about 1 to 2 meetings a semester, and then 1 to 2 events per semester. And if you'll move to the next slide, we actually have a couple of pictures of some of the events that we've done. So one of the coolest things I think that we've done recently was this outbreak simulation. We actually had it this spring, and that's the top left picture right there. And we were able to work with professionals within the industry, epidemiologists and professors and public health officials, and we actually worked through an outbreak case. And so we were given a certain amount of information. We were broken up into 4 groups that were each different types of the industry. So we had some wildlife conservationists, some public health, human med, and then we were given information and we were supposed to work through it. And it was actually a really interesting take on everything, because COVID was just becoming really a big thing. And so that was awesome for us, and we got to work through that and kind of see what an outbreak simulation would look like and how prepared we were. As you can tell, we probably should be more prepared with the COVID response that we're having right now, but it was an interesting first look into that. And then we do a lot of like community outreach in particular. So in the top right corner, we're volunteering with the Special Olympics in town. In the bottom left, we have some socials that we like to do with our groups. And in the bottom right, we did community outreach at what we call First Friday. And so we actually got together with the School of Pharmacy. And if you can see in that picture, it says there's a poster that's like candy or medicine. And so we actually put like sweet tarts and like what Tums would look like. And we were like, can you compare what these look like to different individuals in the community? It was really interesting, and I thought it was one of the funnest events that I've done with the group. And then if Amanda will go, we wanted to talk a little bit about what we were hoping to do within the next year.
Hi everyone, can y'all hear me?
Yeah.
Okay, perfect.
Yeah,
okay, so we're really hoping to expand student involvement, just kind of what Danielle talked about earlier. We want to foster more events and outreach opportunities that'll give students an opportunity to share with the public what they've learned about current One Health topics, just because right now it is such a growing issue and people are starting to realize the importance of interdisciplinary action towards pandemics, and not only just pandemics, but other different scenarios that could be going on. But yeah, so that's all we have. And thank you guys for letting us talk for a little bit.
Great, thank you. Next up, we have UGA. Hannah, you're on.
Hey, can everybody hear me?
Yep.
Awesome, thank you guys. Thank you for joining today. I hope everybody is taking on the current challenges of the novel coronavirus as well as possible. I know that everybody's facing very unique stressors right now. So as mentioned, my name is Hannah Kemmelmacher. I'm a current DVM PhD student, and I'm the president of kind of an ever-changing Southeastern One Health group down in Athens at the University of Georgia. So UGA has had a One Health group for quite a few years now. Oh, I'm so sorry. I thought that this was going to be a PDF version, but yeah, if you can just click through to add the rest of the flyers onto that. Thank you, so sorry. So we've had a One Health group for a few years now, but it seems like we really do put on a different face every few years when the officership changes. But similarly to Texas A&M, we have kind of a mixture of professional, graduate, and undergraduate students, but we're trying to emphasize the undergraduate, as they have mentioned as well. At first, One Health at UGA was kind of a lecture series, but we started to get involved with these large interdisciplinary programming. And We did also an outbreak simulation like Texas and UC Davis have mentioned, but our outbreak simulation was more on the disaster response side. So we had FBI, CDC, Department of Public Health representatives. We had still some interesting epidemiological and kind of vet student-based activities like a chicken necropsy, but the disease that we used for the outbreak was made up, and we had very diverse interdisciplinary groups that were not just vet students, but also the farm med kind of grad students that we have been mentioning. And they worked in groups to draw epi curves and to talk about how to respond to a possible bioterrorism threat. Along with that, we're planning a wildlife disease conference, the second one that we have ever planned to hopefully happen in November of 2020. And we also have suture clinics that are interdisciplinary. So those are just some examples of the bigger programming that we've started to expand into aside from just the lectures. Could you please go to the next slide? Thank you. Our current goals are kind of to make One Health actionable and to make it more real. What we want to do is actually help students understand what it feels like what the difference is between just a singularly focused kind of pre-health or pre-med event versus kind of a training or an interdisciplinary event, and just let people see what the sharing and growth looks like that occurs with those collaborative events. And the second goal is to make One Health, both as a club and as a concept, a resource to students. So we want to make it feel like One Health is worth their time as a cheap or free accessible resume booster and sort of career guide. So I used the same slides last year. Unfortunately, our challenges we've made progress with our challenges, but they kind of still are there. It's kind of sometimes hard to get a high reach unless we're doing one of those very large events that take a lot of time and planning and that have a limited capacity, because again, we try to make them free or very, very cheap. So low reach is definitely a challenge that we still face, but at the same time, we've moved into recording our smaller events and sending them out later. So it's kind of like we have a reach, but it doesn't always look like it because not everybody can be present at some of these events. We hope that our interactivity will improve just with One Health's tenure time at UGA and interaction with other One Health groups as a point of learning for us for different ideas that we can always be incorporating, and just the messages that we can send with some of those large programs. Hopefully we'll have more and more interactivity and show people that truly every single perspective is valuable in the scope of One Health. And as far as our budget goes, we've grown and now we have a larger budget. We found some internal funding, but the budgeting is always in flux. So basically every year we're having to write new grants and set new spreadsheets and try to match our goals. So fortunately, that's not so much of a burden anymore, but it's still sort of unstable. So I wanted to put out some of our challenges, see if other groups were kind of facing similar things. Thank you guys so very much again.
All right, great. I am gonna read a little bit about the UConn Students for One Health. So UConn Students for One Health started in February 2019, and since then we've done many things on campus to promote awareness on the concept of One Health. During the fall semester, we held One Health Week, which kicked off on One Health Day with a campus-wide cleanup and continued with different events every day, including a bamboo toothbrush fundraiser, a One Health club fair, DIY toothpaste making, a fast fashion seminar, and discussion, and closed out the week with a disease ecology lecture with 2 guest speakers. During the flu season, we worked with the University of Connecticut's Student Health and Wellness Service to raise awareness on the importance of flu vaccination, as well as handing out flu preventative kits in the student union. During the spring semester, we held a One Health conference with multiple guest speakers, as well as different activities held throughout the day. Most recently, we collaborated in Student One Health and Wellness again on an online Instagram campaign talking about the most accurate, up-to-date information on the COVID-19 virus. All of these events we have held over the year have been to raise awareness of the components of One Health to the UConn community. So thank you very much, UConn Students for One Health, for submitting that. Now we're going to move to the University of Guelph, which is in fact a audio recording, so I'll play that for you guys right now.
Hi everyone. Sorry for not being present at the webinar today, but I hope this recording will provide enough info. I also hope that everyone is safe and well in this difficult time regarding COVID-19. So my name is Sydney Pierce, and I'm a PhD student in epidemiology, and I'm representing the One Health Student Committee here at the University of Guelph in Canada. The Student Committee is the student arm of the One Health Institute, which is the university's community of practice in One Health. It officially began in the summer of 2019 with the One Health Student Committee beginning in January of 2020, so we're still very new. As a student arm, our goal is to engage with students of diverse disciplinary backgrounds and degree levels, increase One Health awareness, facilitate transdisciplinary and collaborative opportunities, and build networks within and beyond the University of Guelph. What you'll see here is a photo of about half of our committee, and we're particularly proud to be a diverse group when it comes to degree levels and also programs. So we're a mix of undergraduates, graduates, and vet students. We also have a listserv of just over 200 students and growing, so please follow us on our new Instagram as seen here. The website is primarily for the One Health Institute, but also for the Student Committee, and my email is also present. Please don't ever hesitate to reach out, as we're always looking for collaborative opportunities, and I'd be happy to hear from you. On this page, you'll see poster examples of what we've done so far. On the left is our What is One Health seminar, which was hosted back in October when I was working solely with the One Health Institute. The goal of this was to bring general awareness of what the One Health concept and approach is campus-wide. We've also been able to host a couple in-person events and launch our Instagram page since January of this year, so we're happy with where we've gotten so far. Another important initiative was our town hall survey, which was to build an understanding of what the student body wants to know about One Health and what opportunities they would like us to bring to them. This did a really good job of informing where to put our future planning resources, and one of the products was our One Health networking night, originally scheduled for next week but needed to be rescheduled due to the current outbreak. The goal of that was to bring One Health industry, faculty, and student members all in the same room. We also actively disseminate student research opportunities when made aware, and we are trying to facilitate various mentorships. The One Health Institute hosts monthly seminars, which we support, and we are also planning to host the What is One Health seminar annually. Other than that, we are working on various community building activities. One of particular note for this group is our upcoming fall or winter case study competition, where we will invite other universities to come compete with us. So I look forward to seeing the YouTube video after this to gather some contact information, and I just want to thank you all for having me. Please don't hesitate to reach out. Thank you.
Okay, next up we have Faith Turner. I am unmuting you now. You're
Hi.
on.
All
Hey, we
right.
can hear you.
Oh, that's great. I was so worried about that. Hi, so I'm going to be talking to you guys today about veterinary public health at the University of Tennessee College of Veterinary Medicine in Knoxville. And Robert Stiltz is our current public health chair-elect, but both of our emails are there, and feel free to email us at any time. Next slide, please. All right, so a little bit about us. The One Health Club at UT recently got combined with the International Veterinary Students Association. And so we are currently IVSA VPH. And we're really trying to focus on clinical applications of One Health within the College of Veterinary Medicine, partially because most of the students are looking to go into clinical practice, but also because there's a lot that veterinary students don't know about One Health, and we're really trying to get them interested. And one of the ways that we do that is with the DVM MPH program. And so obviously the DVM is coming from the College of Veterinary Medicine, and then a master's in public health through the UT College of Health and Human Sciences. Kind of broad goals for us are integration of One Health philosophy, so looking at the principles of One Health and applying them both in veterinary practice, but also just, kind of in general through things like community involvement. So we've got we had some local cleanup events planned out that we're having to kind of push around. And then, also looking at helping out low-income communities and Spanish-speaking communities in the area, looking at barriers to veterinary care and kind of how we at the College of Veterinary Medicine can help mitigate some of those issues. A new goal for us is IVSA integration. Obviously, we just got combined with them about a month ago, so we're still trying to figure out how we're going to work together. But it's nice to be able to take the One Health principles that we're also familiar with and look at them through a new international lens. Some of our past events, earlier this semester, we had a seminar with our state veterinarian, Dr. John Dunn, and he was very gracious to give us a look at veterinary public health from kind of a legislative point of view, which was very confusing and also very wonderful. And then a discussion of barriers to vet school administration, looking at that through things like social determinants of health and socioeconomic factors. Also, something that we have coming up is a second year Q&A. The College of Veterinary Medicine recently underwent a curriculum change, and so the first years are expressing some anxiety about that, so we're looking to reach out to them. Something that was brought up earlier with the University of Georgia, a lot of our difficulties are very similar to your all, so be very interested in talking to you guys about mitigating some of those. But that is all I've got for you guys today. My email is at the beginning of this, so feel free to email me and of course ask questions at the end of the webinar. Thanks, guys.
All right, I am going to read a message from Hannah Lund, who is the president of the UNMC One Health Club at University of Nebraska Medical Center College of Public Health. She says, we are down in Omaha, Nebraska. We are an interprofessional organization dedicated to raising awareness about One Health. We found out that not a lot of students knew what One Health was, and we wanted to create an organization to educate students about it. Long term, we were hoping to provide research opportunities to students and possibly create a One Health certificate program for the College of Public Health. However, right now we don't have a lot happening and we are very new. Dr. Van Wormer from UNL Nebraska One Health was supposed to come give a talk to develop some student interest, but we aren't sure if that's still happening due to COVID-19. We are happy to be part of ISOHA and look forward to working with you in the future. Thanks very much, Hannah, for that message.
Okay, Caitlin Hawley, if you'll unmute yourself, you should be able to speak. There we go. Caitlin, are you there?
All right, so it looks like we're having a little bit of difficulty.
Hey.
Oh,
Is this working now?
Yes.
Hi, I'm sorry about that. So hi everybody, my name's Caitlin. I'm the current president of our Veterinarians in One Health Club at University of Florida College of Veterinary Medicine. We change leadership annually, so we will have a new president upcoming soon, but on the next slide I have contact for the club in general. So our current activities that we do through the club are monthly meetings where we have a speaker come in, usually around 5 or 6 p.m. after classes are over, and we'll serve food and have someone from the CDC or the USDA. We have a contact with Florida Fish and Wildlife. We have a running list of speakers. So every month someone will come in and talk about a topic in One Health, and we'll serve food. We've started inviting the College of Medicine to some of those events and the College of Public Health, but there's some obstacles and roadblocks to that because the veterinary college is kind of isolated off on its own from everything else. So we don't really know how to get to the other parts of campus, and a lot of students on the other parts of campus don't know how to get to the vet school. So we're working on that, but it's been a little difficult. And then we have some wet labs that we do annually throughout the semester. So we work closely with our veterinary emergency treatment services, and they actually offer an entire weekend to us, 8 to 5 Saturday and Sunday, where any students that attend get operations level certified for technical animal rescue. And then we can sign up for when there's natural disasters like hurricanes, or if there's a local horse that got stuck in a sinkhole, the vets team will actually take some students with them to get hands-on experience in helping in that kind of emergency situation. And then anyone who gets that certification can do a rappelling wet lab the next semester, where we actually go out to the stadium and we get in the ropes and we just rappel ourselves down the side, so that we've had actual hands-on experience with the ropes and how you would be using those in a situation where they were necessary. Just last year, we started a forensics scene workup lab where one of our veterinarians who works in forensic medicine will come in and give us a presentation on how a case is worked up when you suspect there's animal abuse going on. And he goes over how to collect the evidence, how to document the scene, everything that you would do to make sure that it's a legally valid process. And then he actually sets up scenarios with stuffed animals and props and lets us work through them, and then goes through what we did incorrect, how that would impact it in a legal sense, and what we would do differently, just to kind of give everyone a sense of what goes into that, what kind of work. And then we also have a domestic abuse workshop. We've called it the Link Seminar. We've invited the law students as well to come to this event, where we will have someone come speak about how we identify cases of domestic abuse when they come into a veterinary clinic, and how you appropriately get in contact with law enforcement about moving forward with that, and what the veterinarian's role is in documenting all of that and getting in contact with other health professionals for humans that might be involved in the domestic abuse. And then at the end of that, we have an interactive discussion where groups are assigned different amounts of social value and finance value to see how the resources that you have available to you can impact the way that you're able to approach getting out of that kind of situation. And then we also do an infectious disease outbreak scenario, kind of like what some other students have described. Ours is through a course that's taught for third-year students. So it's the same scenario every year. It's a Hendra virus outbreak, and you gown into the PPE and do a mock exam on a model horse that they have available while they're spraying an infectious contaminant in the air. And at the end, when you doff your PPE, you go under a black light to see if you actually contaminated yourself or any of your surroundings in the process of doing your exam and doffing out of the PPE. In the future, we're hoping to do some more joint meetings and social events with the other medical professionals, and also start a monthly newsletter to get more information out to the veterinary students and the public health college and the medical and law students. And then on the next slide, we just have our contact information and our Facebook groups. We're not very active on social media right now, but the upcoming officer board has a new position designated solely for running the social media aspects, so that should be kicking up pretty soon. And then our email, all of the officers have access to and can also direct to our faculty advisor when needed. Thank you guys so much for your time.
Perfect, thank you. Next up, we have Annie Wang with NC State. Annie, it says you're self-muted. Oh, there we go. It looks like you're on now.
Awesome, thank you. Hi, everyone. Thanks for having me today. My name's Annie, and I'm the president-elect for the next year for the One Health Club at the NC State College of Veterinary Medicine specifically. So we are a vet student club run out of SAVMA, and we're currently really only open to vet students, but we're certainly open to collaborating. And we just elected a new board, so these are a bunch of discussions that we can certainly have for the next year. So these were just 3 main events that came to mind, and I admittedly just threw this together. And we do additional things after hearing other people. I realize we do more than just this, but every year we have a dedicated public policy dinner. I apologize, I don't have a ton of photos. This made me realize that we do a bad job taking photos of our events. But yeah, so we host a dinner annually, usually in October, where we invite a lot of One Health veterinary professionals in the area. So for those not familiar with North Carolina, NC State is located within the Research Triangle, and so NC State, Duke University, and UNC represent this Research Triangle, and we can actually tap into a lot of resources among the three universities, and there's a lot of government and nonprofit offices and industry in this area as well. So we have a pretty broad network we can tap into. So we invite usually veterinarians who are either in academia or in government or in nonprofits who are engaged in public health and One Health to have a sort of networking dinner with about 20 of our vet students. And that seems to be a pretty popular event we have every year. Also, we support a small group, about like 5 to 10 students, to attend Vet Student Day at the CDC, which is held every 2 years. So this is a photo from the 2019 CDC Vet Student Day, and it was a really valuable opportunity for us to learn about how veterinarians are involved at CDC. And something we started in 2016, I believe, are monthly epi rounds. And so we host this in the morning before classes start, and we pick an outbreak that was recently published either in the CDC or somewhere else, and we just discuss, we just go through a set group of questions like, who is the population affected, what's the risk involved, and things like that. We also have regular lunch meetings as well that are open up to vet students, usually on some One Health theme, but we will branch out to people beyond the veterinary medicine, the College of Veterinary Medicine for that. And yeah, I would echo similarly to Hannah from UGA that we do have different flavors of activities based on who leadership is. So every year we also elect a new president. And so we do have events that have been held in the past that we haven't held more recently. And it just kind of depends on leadership. And vet students oftentimes get overwhelmed with school. So we don't always get to do all the activities we want, but this is a sampling of what we do. Oh, and at the bottom of our slide is a leadership email. So that's just for whoever the president is. So as we transition, whoever the president is for that year should have access to that email.
Perfect, thank you. Next up, we have Riley Grulish with Nebraska. And if you'll unmute yourself, you should be able to speak.
Hi, can you hear me?
Just speak up a little bit for us, please.
Is that a little bit better?
Yeah, that's good.
Oh, okay, so we are a kind of a small working group that works out of the University of Nebraska-Lincoln. We are primarily right now, I'm the only vet student that attends meetings. We have weekly meetings where it just kind of depends if we have a speaker that comes and talks, or if you discuss a research article or discuss an upcoming outreach event. I think if you want to go to the next slide. Another slide, yep. So a lot of our outreach events focus on kind of younger audiences at the moment. So we have a museum on campus and we'll help with events that they have. We have had conferences, or we've had 2 symposia in the past. And we weren't able to do that this past year, but instead we did a One Health photo challenge. And we started it last November in accordance with the One Health Day, but it ended up going through January, which turned out to be One Health Month, so that worked out well. But yeah, so at the moment, the actual in-person meeting is pretty limited. It's about maybe 10 or 15 people regularly. So we have like an email listserv that goes out to stakeholders from all around the state. And that'll include researchers all over the state and from UNMC. Sometimes we can collaborate with them. So yeah, I am happy to. So we're not an officially recognized club or anything through the university. We are, as Nebraska One Health, kind of like a department within the university. So if anybody has any questions or anything, I'm happy to answer them at the end. But yeah. I have, I think.
Okay, great. Thank you. Next up, we have Lindsay Smith with Tufts. And you're on, Lindsay.
Okay, so you guys can hear me?
Yep, we can hear you.
Perfect, thank you. Well, first of all, thanks to ISOHA for putting this together. I'm having a really great time seeing what all the groups are up to around North America. This is a great idea. So hi everyone, I'm Lindsay. I'm the current president of Students for One Health at the Cummings School at Tufts, which is our veterinary school. So I had the club email on the slide for you guys. I'm the current president, but I've also included Katie Fleming, who's going to be taking over our club next year as president. So I also apologize for the lack of pictures. I'd like to preface this by saying most of our major events for our club are planned for the spring, and unfortunately, they've all been planned and have been ready to go, but are now canceled until next year because of COVID-19, pending any other changes that might come along. But to just give you guys an overview of what we do at the vet school. So a lot of what we do, like other clubs at Tufts, is lunch talks. So during the lunch period, we'll invite speakers to come give a talk on a One Health topic. So for example, we did translational research where we had a professor talk about her research on FELV and how that informed HIV research. We had someone come in from the Mass Department of Agriculture to talk about honeybee medicine and conservation and epidemiology issues facing honeybees. Another one we did was human wildlife conflict, where we kind of did a stakeholder analysis looking at how wild horse populations are being managed out west. So that was really interesting. And we usually partner with other clubs on campus when we do talks like this to kind of maximize multidisciplinary participation and just show other groups how they have some buy-in from One Health as well. One of our big events for the year is One Health Night. So this is a dinner and discussion activity. This year it was actually going to be on COVID-19. And the plan was to split students into stakeholder groups with a faculty facilitator, discuss how their stakeholder group would address this problem, and then come together for a big discussion at the end. Could go to the next slide, please. And then the other events that we do is an elementary school One Health teaching program. So I know this is something that we all talk about as being really important. So our group actually goes out to a local elementary school and teaches interactive One Health themed lessons. So we've been doing ones on Lyme disease, honeybee medicine, how are animals like us, which is a very basic comparative anatomy lesson for kids, among other topics. So that's a really great thing that our club does. And lastly, we do a cadaver exchange. So I think it was UF that said this, but similar to UF, Tufts Vet School is actually kind of removed from the other campuses. So while cross-campus collaboration is a challenge, cadaver exchange is an opportunity that we have to get all the professional students together. So we bring a bunch of animal cadavers to the medical school. Dental students and medical students join this event. And we do a morning of lectures where we talk about comparative anatomy, and then we go into the cadaver lab to kind of do comparisons on the anatomy tables. Last year's themes was musculoskeletal. This year was going to be GI systems. And then we end the day with having sort of a mixer for all the professional students to kind of just get to know each other and see how we're going through similar things at the different schools of Tufts. So that's all I have for you guys. Thanks for listening.
Perfect. Next up, we have Salagna with Illinois.
Hi, can you hear me?
Yes, we can hear you.
All right, thank you, ISOHA, for organizing this and having me present. Hi, everyone, I'm Salagna. I am a PhD student studying epidemiology of infectious diseases. I'm also getting a minor in gender relations and international development. And I am the founder of the One Health Group, the University of Illinois at Urbana-Champaign. Can you go to the next slide, please? All right, so our One Health group is currently defunct. I'm the main contact person for this group because the reason our group was formed was for a very specific reason. So back in November 2017, there was an internal call for proposals within the campus for a project. And I was already passionate about One Health, and I realized that there was no One Health course on this campus. So I wrote out the grant with some of my professors, and we received the grant. It was called the Global Intersections Grant. And with that grant, we basically brought together a big group of people from different departments. These were undergraduate students, graduate students, veterinary students, as well as faculty and some scholars from off campus. And the idea was to basically get this group together to talk about One Health and brainstorm ideas and themes to develop a new One Health course on this campus. So that was about a 9 to 10 month activity that went on. And we were also able to organize the first One Health workshop at U of I. We wanted to present the findings of our One Health working group to the audience. So we had further engagement with other people in the community. We got their inputs and ideas on what we could do further to improve the One Health course that we were in the process of developing. And so we also brought in speakers from other universities in the US, as well as a speaker from India to talk about One Health and One Health allied research and projects that they were working on. And so this went on for a couple of months, and then finally we got another internal grant to help me work on case studies. So our idea was to basically create a One Health course that was targeted at every student, not just specifically students in public health, global health, veterinary medicine, or human medicine. We wanted to target everyone and give them a sort of broad understanding of what One Health is and the, all the amounts of great activities that we can do under that. So I developed 13 unique case studies for this course. And then we were able to offer this course for the first time in the fall 2019 semester on this campus. And it was a full-length course. We had students from different departments. We were able to engage with them. We had 13 different faculty across different specializations who came in and gave a talk. And we had student groups that presented on this, student groups who had to present during the course. And right now I'm actually compiling a manuscript of this entire process. So we will be making our course syllabus as well as the case studies that I've developed. We'll be making them publicly available when the manuscript comes out so that other people interested in One Health education, awareness, and educators can actually access that. I haven't listed any information because we are not doing any One Health related work currently. Also, some of our activities also got suspended because of COVID-19. So that's all I have for now, but thank you so much for letting me present, and good luck to all of you out there. Stay safe.
That's great, thank you. Next up, we have Erin Beasley.
Hello, we are the One Health student group at Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. Our contact details are shown. Our email is onehealthstudentgroup@gmail.com. Our Instagram is onehealth_JHU, and our hashtag is onehealth@Hopkins. We have approximately 60 members, mostly from the Bloomberg School of Public Health. One of our goals is to boost collaborations with the medical, nursing, and business schools, as well as the sustainability initiative. On the next slide, our events this year have included a meeting for World Rabies Day with professionals from the Department of Health, other meetings with guest speakers, a meeting for One Health Day with veterinarians from governmental agencies, public service, and academia, and a tour of the Outbreak exhibit at the Smithsonian National Museum of Natural History in Washington, D.C. with the curators. Since our school has switched to remote functions, we hope to keep connections via webinars. Thank you.
All right, thank you so much. So I'm going to read this from Ross. Ross University is currently in the process of revamping our One Health Club through the collaboration of the SAVMA Global Public Health Officer position and a current SGA club called GIVE, Green Initiative Vets for the Environment. In the past few years, Ross has participated in several One Health fairs that work with the medical schools on the island to offer educational resources to residents and community members. This, along with the One Health Symposium that was held last semester, allowed for the discussion of safety in animal handling, spread of zoonotic diseases, and the impacts of overfishing and pollution on the island. Ideas for the upcoming semesters with the One Health Club include workshops on emergency kits for pets, disaster management training, emergency drills for natural resources, and much, much more. Being on an island poses its own set of challenges, so having the knowledge and the capabilities to know what to do with what resources we have will benefit the student body as a whole. I am very excited to see this club develop within the next few semesters. Thank you very much, Ross.
Okay, next up we have Elspeth Kane with Cornell.
Hi, everyone. I hope you can hear me. My name is Elspeth Kane. I'm the current president of the Cornell Veterinary One Health Association. We're up in Ithaca, New York. We had some events planned for the spring. We had a seminar series with some of our fourth year vet students. Part of Cornell's curriculum in the fourth year involves these opportunity blocks where students, somewhat like, when you can go pursue internships, but some of the more One Health or public health focused vet students who are interested in working in the public sector after graduation did different types of opportunity blocks, whether at the CDC or other state or federal organizations. And so we wanted to give the opportunity. We thought it would be nice if we gave those fourth year students an opportunity to speak about those experiences. And it's sort of geared at the first and second year students so that they know what opportunities are out there and they can plan ahead before third year. We also plan on having, we have a IVSA chair on our board, and we were going to have an ASF talk, and we're going to switch that to a webinar format in light of COVID-19. And that was what we had planned for the spring. We're a young board. We had some pretty significant change over this past year. In the fall, though, we're going to host a 2-day One Health Symposium. This will be Friday, October 16th to Saturday, October 17th. We're really hoping that anyone who's local or has the means to attend who's not local, that they register. We'll have more information on our Facebook page, which I've put the @ link in our slide. And I hopefully, now that I have all of your emails and that we're linked in with this wonderful group, I'll be able to send out information as the event comes to fruition. But we'll have a keynote speaker on Friday. We hope to have a poster competition, so anyone with poster abstracts can submit them. There'll be networking events, and then we'll have various speakers, both domestic and international. Definitely email me, reach out if you have if you want to collaborate, if you're near us in New York, or if you have ideas, and we'd love to see you there in the fall. And just in general, we are really looking to collaborate with other groups, and definitely don't hesitate to reach out. I put the club email, cornellvoha@gmail.com. I also put my own email. I will be the president through December of 2020, but if you email the club account, you'll definitely always be in contact with leadership. Thank you so much for having us, and I hope everyone's staying well, both mentally and physically during this pandemic.
All right, great. I will be presenting on behalf of the Michigan State University College of Veterinary Medicine One Health Club, which is a special privilege for me as I am actually from the great state of Michigan. Okay, so we have some events here. First is the Zombie Apocalypse event. This is a sponsored annual school-wide event that promotes One Health in a fun, competitive way. Teams travel throughout the school grounds dodging wandering zombies to figure out veterinary-related clues and find the antidote to cure the world of zombie fever. Then we have the Small Animal Day. This is a public outreach volunteer event where we're able to promote public health and teach kids about the basics of animal handling, hygiene, and food safety. We come up with a new booth activity each year. Last year, our station focused on proper hand washing techniques and the basics of germs. We also have monthly speaker seminars. Our club seeks out and hosts different speaker seminars during the lunch period. Speakers talk about their area of expertise and connect it to the concept of One Health. Dr. Susan Peters from the Michigan Department of Health and Human Services came to speak about her research on harmful algal blooms and how this environmental condition impacts human and animal health. One of our goals for the future is to portray One Health and public health as something that even general veterinary practitioners can be a part of and advocate for. We want to expand the interest beyond epidemiology, food safety, and government work. Okay, then we have what we're working on is future speakers seminar, working on rescheduling an antimicrobial resistant webinar with a 4th-year PhD student that has been doing research on AMR and cattle feedlots. We're going to work on fundraising by selling stickers that say treat more than one species. The original sticker said real doctors treat more than one species. To encourage the One Health approach, we are doing away with the real doctors portion of the quote. We're also going to sell stickers for syringe vaccination that says prevention is the best medicine. Other ideas for fundraising are onesies for the One Health bar crawl with the veterinary fraternity, Omega Chi Sigma. All proceeds going to Street Dog Coalition, which is a regional program that provides healthcare resources for those who are experiencing or at risk of homelessness, as well as their pets. We're also working on general member recruitment as we work on growing the club. We will also continue to host the zombie apocalypse. Thank you very much, Michigan State.
Hello.
Hey, yep, we can hear you.
Hi. My name is Celine Praxedis. I'm actually an alumni of the U of S. I graduated from nursing. So I'll be representing U of S for everything. So the U of S One Health initiative started in December 2011. It was spearheaded by a bunch of the colleges, notably the Department of Vet Med, medicine, nursing, as well as a lot of the public health, government agencies, and industry. And then in the same year, One Health was actually recognized as the signature research areas. And so what that means is it's kind of one of the particular areas that helps our university to be well known right across Canada. And the nice thing, another thing about to note for the U of S is our campus is actually almost like together between the colleges, so it's easy for them to collaborate. Next slide, please. So I'm not gonna read through everything, but I'm just gonna note the important parts. So in 2016, the One Health panel started. 2012 is when the One Health Club was formed. The first ITRAP, so it's a graduate program to kind of encourage One Health systems in the U of S. So any colleges, any department are encouraged to join, but unfortunately funding was cut for that. So on 2018, the last graduate program was run. And so they've been running for almost 9 years, the OHLE, which is the One Health Leadership Experience. And we, so different colleges from different departments come. So between like vet med, medicine, law, public health, social work, you name it, they are invited to it. So we're trying to make sure that everyone is covered, everyone is aware of One Health, just because, especially for our future lawmakers, we want them to be very, very much aware of what One Health is. So I think that's kind of like my very small and short kind of blurb about the U of S One Health initiative. So sorry about that if I'm talking too fast.
Perfect, thank you. Okay, next up we have Laura Benner and Ashley Miller with SAVMA. Okay.
Hi, can you hear me?
Yes, we can hear Laura.
Hi, my name is Laura Venner. I am a 3rd year at The Ohio State, and I'm also the current Global and Public Health Officer for the Student American Veterinary Medical Association. It was really great to hear from all of you guys and from a lot of different One Health clubs from around the country. It was also really heartwarming for me to see GW One Health. I started that about 3 years ago, so to see where you guys are today was really touched my heart. So I wanted to talk to you guys a little bit about SAVMA. We are a veterinary organization, and the role of GFO, or the Global and Public Health Officer, is to kind of teach veterinary students about One Health. And so we are doing a lot of different projects. As you can see, there's a lot of different posters that we've done. This is just what we've done in the past year or so. I wanted to share with you guys this One Health discussion forum that was started about about a month ago or so. If you are a veterinary student, or if you are a president of a veterinary One Health club, please feel free to join this Facebook group. This is going to be a shared space for veterinary students to talk about One Health, to share internships, externships, scholarships, jobs, and opportunities. We are working this year to hopefully form stronger collaborations with different organizations of medical students, dental students, pharmacy students, more on a national level. And we're hoping to kind of share that with our different constituencies. But we were really great. It was really great to hear from all of you guys, and we have some ideas, and we really hope to help you guys with some of the challenges that you all seem to be having, kind of as a, which all seem to be very similar. But feel free to reach out to us, and you could follow us on our Instagram page at Student AVMA as well. So thank you guys for letting us have a couple of moments to chat with y'all. It was great to hear from y'all.
All right, thank you so much, everyone. That concludes our student presentation portion. And now we're gonna move on to our question and answer session. And I just wanna briefly describe how this is gonna work. So ISOHA in general has sort of two proposals to put forward that we would love to receive your feedback on. So I'm gonna start with those two, and then we're gonna open the floor up to anyone who has a question for another group, or just a general question about ISOHA. So the first proposal that I would like to bring to your attention is in 2018, we did a survey of North American One Health groups and learned that they wanted more networking opportunities between clubs and professional development opportunities. Based on these results and the success of the global ISOHA WhatsApp group, which maybe some of you are part of, we are proposing a Facebook Messenger group to facilitate direct communication among leaders of One Health groups in North America. This group would help you to advertise events and collaborate across campuses. And I just want to interject here and say, I feel like, especially with COVID-19, where we're moving a lot of things online, being able to communicate group to group is a great way to advertise events and maybe get more attendees for your online webinars and events. So I'd just like to open the floor up now to any questions about this. Is Facebook Messenger the best way to communicate? And what are some other ideas that you have of ways we can generate discussion and help each other out as a community?
Okay, it looks like Dr. Cheryl has a comment on this.
Yes, I do. In the One Health Happenings, there is a student section, and I've been making myself notes of things that I wanted to be sure and bring forward in the discussion part of this webinar. Please, 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 if you have an event going on that you would like really for the world to know about, it could be put into that student section in the One Health Happenings. And the other thing that I really want to urge all of you guys to do, because I'm hearing all these amazing, amazing activities that you're doing, please go and register any event that you're holding for One Health Day celebration. It costs nothing. It takes just a few minutes. Go on to the One Health Day page. I'll put a link to it in the chat box. And be sure your event gets registered so that we can put a pin on the map for the world to see that you're doing it. But for promoting your events, from student group to student group, not only is it fabulous to use Facebook and and WhatsApp and all those great platforms. But please, let's put them in the One Health Happenings also, so that the whole world can see it, because you have no idea how inspiring it can be to groups all around the world to see what you're doing.
Perfect, thank you. If any, oh, Elspeth, let's see. Elspeth, if you have a comment, yeah, we can hear you.
Okay, I was just wondering if it might be better to do a Facebook group or like a private, whether it's private or public, rather than a messenger chat. I don't know if there's more features like in terms of posting documents or images, but it was just a thought.
Yeah, I'm curious what other people think about the group versus chat dynamic. Don't be shy.
Yeah, if I could just jump in for 1 second. In terms of the makeup of our proposed chat group, it would basically be leaders of One Health Club. So there's a lot of One Health Clubs out there, but we likely wouldn't have more than 50 to 100 people, which is okay for a messenger group, I think. And then I have another comment from someone else who's listening in. Go ahead.
I was just gonna suggest that depending on how you are structuring this group, that the Facebook group might be a more streamlined option rather than having constant chats that are kind of popping up. People could be able to find posts more easily and kind of have threads associated with it. So.
Hey, I just wanted to make a bump off of both of those comments. This is Hannah from UGA. I also would lean towards the Facebook group, though I think a Facebook chat would also be workable, because in the Facebook group we can have several different threads going at the same time that are more easily searchable, so that we don't have to just scroll to the top to find discussions about certain pertinent topics. So we can have a thread for, like, I don't know, fundraising, a thread for managing funds, a thread for ideas to reach out between different organizations, etc.
I think one salient point that's also worth bringing up is that we do have the ISOHA community group on Facebook. And granted, a lot of the sort of social dynamics and just how clubs function in North America, and I suppose Europe to a degree, are going to be different than a lot of the rest of the world. And all that being said, I'm curious what people think the utility of a specific North American Facebook group would be versus that larger one that we already have.
And by the way, if you have a comment on this, feel free to jump in if your hand is raised, and I will. Yeah, you may be able just to unmute yourself.
Oh, can you
go,
just
Riley?
Hi, so I guess on the Facebook group versus the chat, I would also agree just that a group might be a little easier to, I know there's already kind of a WhatsApp group and can be a little hard to follow if everybody's kind of just one big long thing as opposed to a Facebook group for the North America.
Hey, Riley, we're having a little bit of trouble making out what you're saying. I'm not sure if that's just me. That might just be.
Nope, is this better?
It's just a little quiet on my end too.
Okay, sorry. I'm on my like headphones because I don't have my laptop with me, so that might be why. Can you hear me?
Yeah, you're coming through a little bit clearer now.
Okay, I'll just kind kind of end what I'm saying. But and then also I think it would be nice to have specifically a North American group, just as far as maybe organizing more regional events or organizing events or think coordinating among North American groups just as far as proximity goes, just to kind of develop stronger connections more on I don't want to say local because that obviously would be the whole continent, but maybe just as far as coordination goes would be a little bit easier. And that's all.
Great. Yeah. So if I can just, oh, sorry to interrupt. Go ahead.
I was just going to say, I agree with what Riley said. I think having a US Facebook group might be useful, and we can even consider getting more specific than that, or have specific threads for regions of the United States as far as, trying to connect institutions that are a little bit closer to each other to try to facilitate events, for example. But yeah, I think that would be a great idea.
Yeah, and if I can just interject briefly to summarize, from what I'm hearing, it sounds like we agree that a Facebook group would work, and then we could either have topics on the group, or potentially, for example, if someone is running a webinar series and someone wants to reach out to them directly, then they can then message them. And that way we'll, kind of facilitate that one-on-one communication through Messenger, but have the sort of overall planning structure as the group. And I can volunteer myself to connect with all of you on Facebook and try to make that happen in the near future.
And so Hannah, you mentioned the having threads or sort of streams. Can you elaborate on what you mean by that?
Sure. We've managed really large Facebook groups in the past for ongoing activities, for like certain wellness activities. And basically, we had one or two administrators start different posts within a Facebook group. And then there were certain stipulations for how people were to interact on that group, which was you only post comments underneath certain threads unless there's a thread that you wanted to, like a topic of conversation that you wanted to have that wasn't in place already. Alternatively, if you wanted to have it really, really organized, if someone wanted to start a new discussion, they could just message the admin of that group and have them start it, so that every single topic, overarching topic, starts from a certain person, and it makes it a little bit more identifiable. Does that help clear up what I mean?
Yeah, it does. And I'm gonna throw this out there just kind of for the heck of it. I'm curious if people are familiar with Slack at all, or I suppose you could go with any other variety of sort of business messenger type tools, and they really lend themselves to having these separate streams that you can, put your comments in that are specific to, certain subject matters, and that could potentially be more streamlined. But I know the adoption rate for that's not incredibly high, especially versus Facebook. And if anyone, wants to just like shoot that down, that's totally cool. But I just want to put it out there.
Yeah, no, this is Elspeth again. Our club actually just started using Slack, and I know, I agree that it would be a great idea. I know that it might be harder if we're trying to connect a lot of people from a lot of different places, because a lot of people already use Facebook, but Slack definitely is nice because you can sign on to the channels that you want, and you don't have to get notifications about things that aren't relevant to you. So I don't know, it's just also an idea if other clubs want to do this, because we have different Slack channels for different events going on, or different planning committees for our symposium, and it's been helpful. So yeah.
Yeah, we could create an ISOHA Slack that we could all sign up for, and then sort of like club leaders could be on there to promote or discuss their events.
Yeah, and it's also not just an event thing, and that's certainly a very important function of this sort of community, whatever we're going to make it. but also it's really helped us to kind of get a pulse on what the community wants in terms of just how to set up our basic organization. If other clubs want to not just share events, but share their own methodologies between each other for how they actually function as a club, it's incredibly helpful for that because, one thing that we don't actually talk about or learn too much in our training is things just like organizational psychology and management. And being able to group source that and group source that information is incredibly helpful.
Yeah, just to chime in, this is Lindsay. So I think Slack might even serve a better purpose for this than a Facebook group because it sounds like the goal that other people are bringing up is to organize all the information that people are posting as much as possible. And while a Facebook group I think is a good idea, it's still kind of all in one place, like all in one page, right? Like I think Slack could be good to separate by topic, by channel, and even like you were saying, Neil, like sharing information about how you run your clubs. I just feel like Slack lends itself a little bit better than like commenting on a Facebook post. But that's just my opinion because most of the clubs that I'm in right now, we do use Slack and we have like so many channels for each thing. And I think if all of that was on one Facebook page, it would just turn into a lot of sifting through various topics all the time.
Hey guys, this is Cheryl. I have a question. Evan, are you there?
Oh yeah, you're good. Go ahead.
Oh, okay. So my question is, what you're talking about right now, are you talking about limiting it just to North America groups, or is this something that groups around the world would be able to see and participate in?
Yeah, so we already have the global WhatsApp group, which has been very successful, I think, in sort of hearing directly from club leaders around the world. The reason that we wanted to propose a new method of communication in North America is not very many people use WhatsApp in North America. And we were finding that we were getting a lot of people from one region or another and not necessarily like the totality of North American leadership. I guess I could say one option would be for everyone to get WhatsApp and get on there, but I think we're trying to find a way to better communicate amongst our region based on the way people are communicating currently.
So it's not that you want to not include the rest of the world. It's just that it's the medium that's most commonly used. Oh, the WhatsApp's not as much used, and I've learned that myself because some of the South American groups were using. I mean, they're really the One Health Latin America Coalition is going crazy, forming up using WhatsApp. So I understand that point, but the reason I was asking is I think the conversations you guys are talking about and even awareness of the events would be of great interest to students outside the North America group. So that was just what was driving my question.
Yeah, it's a worthwhile discussion and thought to have. My initial thought is kind of WhatsApp doesn't necessarily lend itself to the different channels that we're discussing because you'd have to create a separate WhatsApp group basically to have a different quote unquote channel. So the WhatsApp group we have now is really just general discussion and people bring things up as they see fit. And what happens is if you're not, on top of it all the time, then you miss it and you would have to go back and it gets kind of disorganized. And I don't think that my impression anyway is that the global population is not so much into Slack or Facebook pages.
So if you, and I would love to learn more about Slack because I'm part of the old fogey generation that doesn't know a whole lot about social media. But if you did create a Slack for North America, is it possible that it could be open to the rest of the world, or would it be a closed group?
That's a good question. Oh, did you want to take that, Evan?
No, you got it.
Okay. So one of the things that has been suggested to us by, I'm not sure if people here are familiar with the One Health Workforce, and I guess now it's One Health Workforce Next Generation. But we actually have some people here who I believe are associated with that group listening in. So hello to you guys. And that's actually a sort of USAID initiative that has been really the reason that a lot of clubs in different regions of the world exist, especially in Africa and Southeast Asia, that are part of our network. And we were actually given the privilege of talking to one of the people who deals with the students in those networks very recently. And he suggested that we have these different chats basically for each of these different regions to give them a better source or a better sort of sense of cohesion amongst themselves that they can then bring to the global level. And this would sort of be that for us. And I mean, I can totally get that in a sense it can feel like we'd be trying to seclude ourselves, but in another sense it would be basically trying to form more cohesion, more structure, more integrity as a region, and basically strengthening our own base so we can then bring that to the global level.
Yeah, and I would just put a pin in this for a second, just in the interest of time. So I think we've kind of had a good discussion about how communication could work. It seems like the consensus, at least from those who have spoken, is that Slack may be the best channel. I think what I'll do is after this webinar is over, I'm going to email all of you, since all the presenters, I have your emails, and we can potentially pursue that at a later date. I would just like to now go on to the next sort of point of discussion, which I think we covered a lot in the student presentations actually, and that is how to best pursue professional development. In other words, we as ISOHA would like to bring these professional development opportunities to you and to your groups. And the question is, how best can we do that? Whether it's us setting up webinars and having somewhat of a career fair where we bring different organizations to the different groups that make up ISOHA, or whether we can just be sharing each other's professional development opportunities so that there's a wider array of attendees to the own webinars that you're sending. So do you guys have specific questions or comments about professional development and how ISOHA as an organization can best serve you and your members?
Hi, this is Elsbeth again. I think that, and I'm from Cornell, just as a reminder. I think that if we did follow a Slack format, although I know that we're going to pursue that at a later time, but there could be a channel for career development, and then maybe there could be a shared Excel file or something, sort of like the one we had to sign up for the webinar today. And there could be tabs on it, like either full-time job opportunities or workshops and seminars or externships or internships or undergrad opportunities, whatever it is. And then people could post links to them, and maybe there could be columns like when is this opportunity, if it's a shorter term thing, and maybe just like a website link or something. I don't know, it's just a thought, but I think a lot of us have individually pursued different things, and it would be nice if there was just like a standing document where we could post these opportunities.
So I have to step in here, guys, because Evan, if you have a way to pop over to the Commission's website, I'd like to show you those spreadsheets already exist on the Opportunities Bulletin Board. And so that's what I was urging you guys to go submit the opportunities that you know about, and also look, because this bulletin board is starting to be used quite a bit now. So those spreadsheets are there and ready to be used really by the world. Now, I don't know if what you guys are talking about is just regional, but so go over under resources and pop down to Opportunities Bulletin Board, and then scroll down. Scroll down. So there, don't wait, you get too far. So there are certificate programs and courses and online courses and summer programs and externships and internships. If you have another category, I would love to to create it, and these are actually can actively be submitted by anybody around the world. So say just click, if you don't mind, Evan, click on the summer programs down toward the bottom of the page there. Click on Review Summer One Health Programs. So if you had clicked on Submit, it would take you to a form. So what I usually do is I'll go and instead of 100%, I'll make it like 65%, just so I can see more of the page at once. Up at the top left there where it can, the size. So you know, these exist, and I would love to see us making sure that they're robust. And if you have another idea of another page, the commission is very happy to work with you. And this is where ISOHA and the commission have really kind of, we're joined at the hip. We do all these things together. These are One Health community projects. Nobody owns them. We just all do it together. Is that kind of what you had in mind, Elspeth?
Yeah, I think this is great. I didn't know that it was already available, and I'll definitely encourage people that I know in my community to submit here.
Awesome. Thank you.
And on that same note, the map that we have a picture of at the beginning of the PowerPoint has a lot of the same opportunities on it as these spreadsheets do. And we're in the process of making sure that the spreadsheets and the map line up exactly. But it's an internship and degree program map. And so if you go to tinyurl.com/ISOHA map, you'll be able to see those different opportunities around the world. And like I said, we're in the process of making sure that it lines up with these spreadsheets.
Yeah, and if I could just jump in, to me, this seems like a great example of what we're trying to do with our Slack or Facebook group, but I think we're leaning towards Slack maybe, which is if we have a thread on educational opportunities, we can be discussing these links and these spreadsheets and sort of planning to release these materials together to our groups, because I know a lot of us, email our groups, regularly about events and things, but we can sort of work together, at least in my my thought process of, how do we want to tell people about these different things that are available, and we already have this great resource. To me, it's a matter of figuring out how best to let people know about this resource, which I think increased communication among us all could really help facilitate.
Hey, this is Hannah from Georgia. I agree with you, Evan. I think that increasing our kind of intra-organizational conversations will make these links more apparent to everybody. Specifically, I mean, we have these links listed on our website, but I wanted to throw out another potential idea that's a little bit different. And again, as Neil said, feel free to shoot this down. So possibly, I know that sometimes when I get issues within our group where people aren't working together to the extent that I want them to, and I've made it very voluntary for different members to work together, sometimes it helps to generate a little bit of forced interaction. So as a potential idea, we could pair up, or sorry, not pair up, but group up different One Health student organizations and give them a really extended, non-threatening deadline, or give us a non-threatening deadline by which to generate something together, and then report that back to the group and post that back to here. And so that could be something that is completely remote and no cost. For example, a manuscript about how to organize some sort of One Health related event, and then we could start another file where we could share some of those manuscripts. Step 1, reach out to these people. Step 2, generate little committees, whatever. Other things that we could assign would be potentially, if those groups were close together, make them do actually organize an event together, even if it's remote, like a little webinar, or have them, generate some curriculum, have them generate community projects, etc. Just kind of make anybody who's willing to participate group up into small groups and have an actual output. I think just that process might help us get to maybe the collaborative state that we want to be as ISOHA World and ISOHA North America.
Yeah, I think that sounds like a great idea. ISOHA, actually, the Google Drive has already been compiling some of those resources in terms of putting on events and things. I think if we could get more connected, like you're saying, it would allow us to add a bunch more events on that resource, and obviously making people aware of it, kind of like making people aware of this part of the website, One Health Commission website, would just do a better job of getting people thinking about, you know, what can you do for your group? And if you need help, you can ask someone who is just a message away. So I really like that idea personally.
Yeah, and I wouldn't want it to be a burden necessarily, but at least personally, you know, if ISOHA said, you know, Hannah, get in touch with, you know, Ontario and Wisconsin and, you know, at Cornell, and like now in 1 year work together to do, like, to kind of generate some sort of deliverable, maybe, as I mentioned, like a step-by-step guide to tabling for One Health awareness. I mean, I would enjoy that sort of opportunity, and then we would upload it to some shared file, and that we would have generated that connection between ourselves.
So I think we're at a point now, unless anyone has any other comments on that, where we can just open it up to general discussion. And I would encourage people who haven't spoken yet, or just even have a thought, or want to say how they feel about this webinar or the current One Health community, to chime in. We would love to hear from you.
I think we had a couple of comments about the One Health Act. Scott Johnson, if you want to bring that up, you're welcome to.
Okay, can you hear me?
Yes, we can hear you.
Hi, this has been very exciting, and I thank Dr. Stroud and the One Health Commission and sending out the newsletter and invitation. It's been fascinating. I commend you all. Yeah, my comment was, you are a huge force to be reckoned with, and we really need a lot of help and even information dissemination on these bills in Congress. And so many people just don't even know about it. And if these had been in place a couple of years ago, we wouldn't be where we are with the coronavirus. And knowing that zoonosis and these pathogens, they're not going to go away. We're going to continue to see them leaping from animals into the human population. Your generation is going to be dealing with this over and over again. So I would encourage you to mobilize all you can, get in touch with your senators and representatives, get behind the work that Dr. Stroud and others are doing on the Hill, and let's make some noise.
Scott, this is Cheryl. Thank you so much for those comments. I would also, I know that there was a question coming up that Neil was going to bring up about how students might get involved. So I'll just throw out a few ideas. And Bailey, please chime in here, because I know you've already done this at your school. Go to your administrators. If you're at a vet school or a public health school or a medical school or a nursing school, and make them aware of this coalition, you know, see if they even know about One Health. It's a great starting point. And one of the points I always make to people is, you know, this is a time for us not to sit on our haunches because we're a little intimidated to go do something like that. You know, we've got to be brave to get out of our comfort zones. I've never been a very political creature. If you told me I was going to be helping to lead briefings on the Hill a few years ago, I'd have told you were crazy, because I've just never been very political. So this is a time for us to get out of our comfort zones, look for what we can do. I'll put something in the chat box here about an email invitation link that you can share with administrators at your schools to see if they would like to sign on to the coalition. And also, you guys watch for a letter writing campaign that's about to be launched, and take it very seriously and get very active with it. It'll be coming out hopefully very soon through the commission and ISOHA listserv. So I'd love to hear other ideas, maybe that Bailey or Neil or Scott or any of you have about how students can really Scott is right. You guys are an incredible force. I mean, just look at what Greta Thunberg was able to do. So never underestimate the power of students. You have an incredible force in the world. So I'd love to hear other comments and thoughts about what you guys think the students can do.
Hey guys, this is Bailey. Just going off of that, I thought I would share a story that might be encouraging to some of y'all. So I got to go to the AVMA fly-in last month and meet with one of my congressmen, one of my senators, and then staffers from another office. And I talked about the One Health Act, and I wasn't really expecting them to co-sponsor just because, of course, they have a lot of things going on and things move slowly in DC. But since I am part of a pretty rural district in Mississippi, the 3rd Congressional District, they're very proud of the vet school. And so they sort of viewed it as a way to help out the vet school by co-sponsoring this act. And, you know, of course, I think they do see the important public health implications as well. But, you know, a lot of these districts thrive because of their vet schools. So if you could just throw that in there, that this is something that is really important to veterinary students, I think that can help your argument a little bit as well. So I was not really expecting my congressman to co-sponsor this. So I was not checking the Congress website very frequently. And then about a month or maybe 6 weeks after I visited with him, I got an email from AVMA saying that my congressman had co-sponsored the act about a week or 10 days after I talked to him. So all that being said, just be encouraged that your voice can make a difference. Especially if you can frame this in terms of, you know, this is important to veterinary students. And also, just like Dr. Cheryl was saying, yeah, just kind of take a leap of faith. If this is not your usual cup of tea, I would just encourage you to kind of push past that and realize that this isn't a time to be timid, especially because there's only, what, 9 months left in this current Congress for this to get passed. So if you have any questions about how you can write or call your congressman, feel free to email me. My email address is at the beginning of this PowerPoint. And of course, you don't have to go to DC to be a part of this conversation. You could have a meeting in your district office. And, you know, that might not be possible right now with the pandemic, but phone calls, I think, can be effective too. So that's all from me.
Congratulations, Bailey, on those activities. This is Cheryl again. I just I want to commend you for putting yourself out there, and I hope that we'll be doing that. Also, this letter that's about to go out, it'll have a lot of information that you can use to make yourself feel more comfortable getting out of your comfort zone. So kudos to you guys.
Thank you. And also, one more note about that. If there's someone at your school that is in charge of marketing or outreach, they might be the best person to talk to about getting your school to sign on to the One Health Act Coalition, just because the deans, of course, have a lot of emails pouring in and a lot of things going on. But the people that do marketing and communications at your school, I'm sure you could just pop into their office and just tell them real briefly what this is about, and they'd be happy to talk to you. That's what I did. So hopefully my school will sign on. We'll see.
Also, my understanding is that individual clubs can sign on to these things. If you want to sign on to any letters, Cheryl, you can add in about this, but I think we're still soliciting people to join into just the general coalition as well. Generally, schools We'll be okay with that as long as you are pretty clear that you're not representing the school itself if they are not on board as well. Some schools are kind of stingy about you using your school institutional email to do all of your outreach and stuff, though I have most definitely done that with mine with zero repercussions, but just be aware of that.
So right, Neil, that's what I was talking about. The thing that I put in the chat box, that's the invitation to organizations to get involved. So then this next letter writing campaign that's about to be launched, absolutely, not only will it be an opportunity for individuals to really raise their voices, but also to be sure that any organizations that they're associated with could actually add themselves onto the coalition. And yes, indeed, we would love to have student groups added to the list of the coalition. Right now, that's over 70 organizations. I'm a little surprised that the numbers don't seem to continue to be growing, although we've pushed that invitation out for a second time. So, you know, please, let's mobilize the student network to help us make this happen.
That sounds great. I think this is a good place for us to close, unless there's any more pressing questions. But I just want to let you guys know that we are for sure going to be getting all the information out, not only those links that are in the chat box, but questions about what our best communication strategy is going to be moving forward. We are planning to send an email out today with all of that information for you, and of course we will be in communication. So I just wanted to close by saying thank you so much for attending the webinar. It was really inspiring to hear from all the different student groups. I think it's safe to say in light of the COVID-19 pandemic, One Health is more critical than ever. We're all practicing social distancing to protect our communities, but that doesn't mean we have to stay isolated from each other. Please join us in promoting One Health in North America and building a strong community of future professionals and colleagues. In addition, we can support each other in this challenging time. And I look forward to staying in touch, and thank you so much for your participation.